one of the reasons that Lyft got into healthcare is because they were noticing that rides were occurring in Manhattan, but they were being called from Salt Lake City. And it tripped their fraud analytics. And they started digging into saying, why are all these rides happening in Manhattan, but they're all being called from this exact same location in Utah? And there are organizations that manage transportation programs on behalf of payers, and there was one of these entities, and they couldn't get their normal transportation providers to pick up these riders for whatever reason, and they had a bunch of burner phones, and they were calling Lyfts on their consumer accounts to get them to come fit in. So, I mean, I just use that as an anecdote for how strong the product market fit was for an on-demand network in a world where you typically had to call in 3 days in advance for your appointment. And obviously, you know, a Lyft can get to someone typically in 5 to 7 minutes. So I think, you know, as I look at healthcare, and there's so many digital health company startups right now, you know, product market fit is obviously number one. And right now, I think you're seeing a lot of clustering in digital health around certain areas, and there's going to be some kind of reckoning, some kind of consolidation at some point in the next couple of years. But you know, Lyft was also going around a not very sexy part of healthcare. I mean, so I think finding the broken bits of healthcare and innovating on them, even if they aren't sexy, continues to be important, because that's a lot of what, you know, healthcare is, and a lot of what needs to be improved.